make sure that we are getting a good cross-section of views on this issue, so why don't I call on our Republican leader, Mitch McConnell, if you've got any thoughts or comments on this.
First of all, Mr. President, thank you very much for having this session today. I think it's useful and it is significant. Ted indicated that earlier, everybody in the room. I'm also among those, as you and I discussed before, interested in seeing us address entitlement reform, and admittedly Medicare and Medicaid would be a part of that, but also Social Security. And particularly concerned about having a mechanism in place that guarantees you get a result. And I wonder where you see yourself and the administration now, for example, in supporting something like the Conrad Gregg proposal, which would set in place a mechanism that could actually guarantee that you get a result, if not on Medicare and Medicaid, at least on Social Security.
Well, I appreciate the question, Mitch. As you know, we had I think they can hear me. As you know, we had a fiscal responsibility summit similar to the gathering that we've had here, although I have to say the attendance here is even greater. And what I said in that forum was that I was absolutely committed to making sure that we got entitlement reform done. The mechanism by which we do it, I think, is going to have to be determined by you, Harry Reid, Nancy Pelosi, and John Boehner, and the members of Congress. We've got to make certain that the various committees are comfortable with how we move forward. But the important point that I want to emphasize today is that on Medicare and Medicaid in particular, which everybody here understands is the 800-pound gorilla, I don't see us being able to get an effective reform package around those entitlements without fixing the underlying problem of healthcare inflation. If we've got 6, 7, 8% healthcare inflation, we could fix Medicare and Medicaid temporarily for a couple of years, but we would be back in the same fix 10 years from now. And so our most urgent task is to drive down costs both on the private side and on the public side, because Medicare and Medicaid costs have actually gone up fairly comparably to what's been happening in the private sector, what businesses and families and others have been doing. That's why I think it's so important for us to focus on costs as part of this overall reform package. With respect to Social Security, I actually think it's easier than Medicare and Medicaid. And as a consequence, I'm going to be interested in working with you. And I know that others like Senator Durbin, Lindsey Graham, have already begun discussions about what the best mechanisms would be. I would remain committed to that task. But if we don't tackle health care, then we're going to break the bank. I think that's true at the federal level. I think it's true at the state level. It's certainly true for businesses, and it's certainly true for families. Okay. Henry, do you want to just give a little feedback in terms of what you heard and any points you'd like to make?
Thank you very much, Mr. President. Let me just say that Senator Kennedy will not be a foot soldier in this battle. He has been the inspiration to all of us, all Americans who held out the dream that every American ought to have affordable, quality health care. I want to salute him for that. President, by bringing people together, the different stakeholders, the people representing different interest groups, the Democrats and the Republicans, all of us together, I think he's given us an opportunity not to insist that we get all that we want, but to realize that we're part of the process. And that if we don't get everything we want, the alternative is not to do nothing, as you pointed out earlier, but to make sure that we've got the best system we can develop. And that has to be a system that includes all Americans in health insurance, that they'll be able to hold on to if they're satisfied with it, or to be able to access if they don't have it at the present time. So I think this is a very useful meeting. Our breakout session was very on point. And And I think it leads all of us to recognize that we have to work together. We all need to recognize there's going to be trade-offs. If we don't get the trade-off exactly the way we want it, we've got to recognize there's a broader public goal and purpose. And your leadership, I think, is going to make this possible for the world.
Thank you, Henry. Is Joanne Emerson here? There you go. Good to see you, Joanne.
Thank you very much for having me here today, and thank you very much for your passion on this issue. Coming from a very rural, poor district in southeast and south central Missouri, I have so many constituents who have no insurance, nor do those who have insurance necessarily have access
To provide.
to providers, particularly primary providers. And so for us to be able to get together, all stakeholders, members of the House, Senate, Republicans, Democrats, business, labor, you name it, I think that's critical. And I hope that all of us from both parties will be willing to kind of take a fresh look and say, you know, if there are laws that we had on the table before, that they need to be opened up if we need to change the system. And I think all of us have to be willing to kind of give a little, if you will. And I thank you so very much, because for me, this has been a passion for all 13 years I've been in Congress. Thank
Well,
you.
listen, I appreciate your point, Joanne. I want to amplify it. I think it is so important that all of us make decisions throughout this process based on evidence and data and what works, as opposed to what our dug-in positions may have been in the past. Because if we can at least agree on a set of facts, we're still going to have tough choices, but we're more likely to make good decisions on behalf of families. And so I want to be clear about my own position in this process. During the campaign, I put forward a plan for health care reform. I thought it was an excellent plan, but I don't presume that it was a perfect plan or that it was the best possible plan. It's conceivable that there were other ideas out there that we had not thought of. If there is a way of getting this done where we're driving down costs and people are getting health insurance at an affordable rate and have choice of doctor, have flexibility in terms of their plans, and we could do that entirely through the market, I'd be happy to do it that way. If there was a way of doing it that involved more government regulation and involvement, I'm happy to do it that way as well. I just want to figure out what works. And that requires us to actually look at the evidence and try to figure out, based on the experience that now has been accumulated for a lot of years, how can we improve the system? And I'm absolutely confident that there's going to be some low-hanging fruit. For example, the issue of health IT. I don't think there's any dispute between Newt Gingrich and Ted Kennedy that if we digitalize our healthcare system, we're going to save money over the long term. And we're going to reduce error and save lives. There are going to be some other areas that's not such low-hanging fruit, and there's greater dispute about what might work. But we have to keep that open mind that you called for, Joy. That's going to be great.